nonprofit, are all the properties tax exempt, or do you guys have to pay tax on some of the properties?
So any property or building on property that AHN St. Vincent owns is a part of our not-for-profit system. So technically those are the ones that are tax exempt. But of course we're part of a pilot program, and we pay in lieu of taxes an amount that was previously agreed upon to the City of Erie, the County of Erie, as well as the Erie School District.
And I know that's a 50% pilot so far. How is it for you to be able to contribute that to the city?
So there are so many examples of being a part of a not-for-profit organization, a health system, that we contribute to providing support for those that we serve. So in lieu of the tax assessment that we give, we certainly give financial support to the tax entities of this community, the county, the city, the school district. So we do still pay a percentage of taxes, what the original tax assessment would have been. But then we also have other ways that we give back to the community and provide service to others with either providing extra access to care, special access to care through screening events, through identifying chronic diseases for those that don't have insurance. So serving those that don't have access to insurance or payment is a big area of where we focus.
Let's dive into those other things you guys do for the community. For example, you guys just built the cancer center. There's so many different things happening here. So talk to me about that and the different services you provide for the community.
Yeah, so as the community knows, I'm sure well enough, Highmark Health and AHN have been committed to increasing access to care. So over the last over a year to 2 years, we've been investing in growing our facilities. So our brand new emergency department, new ER building, our cancer center, are concrete ways that we've improved access to care. Our health and wellness pavilions, we're bringing primary care closer to where patients come from. So those are clear-cut ways that as a not-for-profit system, we've been able to reinvest in our own facilities to improve access.
Now, is there specific programs that you guys have that kind of reach out to the community or in order to help those in need?
Absolutely. We have a mobile medical unit, for example. I hope the community recognizes that we have a bus that drives around that can serve the community by providing screenings. So we go to a lot of community health events, health fairs. We go to sporting events that we can serve athletes at those settings. So lots of ways that we provide extra touch points where we can do screenings, blood pressure checks, cholesterol checks, and so forth. A lot of these people that we service don't have primary care physicians. So then we can actually get them connected to primary care as a result of those encounters too.
Being so involved in the community and continuing to grow in the community, how has it been a part of this transformation, assisting those in the area?
Yeah, it's been amazing to be a witness to, with all the investments going on, how we've actually been able to make a difference. So we can clearly see that in the number of patients that we serve on a regular basis here, even in the emergency department. So our brand new emergency room, which has more capacity to take care of patients, has seen growth. So, and of course, we want it to be the right choice with regards to using the emergency room setting. So we want to make sure that people don't go to the emergency room inappropriately, but likewise we've seen improvements in our numbers in the primary care offices, in our urgent care. So that clearly means that people are taking advantage of the extra access that we're providing to care.
Now, this story came to light after hearing from taxpayers' concerns that nonprofits are just continuing to build in the city and taking over more properties. So what's your message to those who have those concerns about the work your St. Vincent is specifically doing?
So there's lots of examples about the give backs. You know, whether you measure the amount of encounters that we have for people that don't have payment for services. In total, our health system has provided $170 million worth of support for uncompensated care across the entire footprint of Highmark Health and the Allegheny Health Network. So we are quantifying the give back, but then really it comes down to the actual encounters themselves, where we truly make a difference. And lots of stories out there that are amazing to me when someone who hasn't seen a doctor in years, who comes up to one of our screening events and is identified to have diabetes and they didn't know it, or blood pressure that's out of control. And then right then and there, we can start to address that issue and then get them into the system so that they can get the care that they deserve. This is a rich source of information. So ever since the Affordable Care Act, all not-for-profit health systems are required to complete a community health needs assessment. And in this community, we've partnered with other health systems to do that collectively so that we're identifying what the main issues are. So AHN St. Vincent is proud to promote those efforts and what we have done about it. And I do encourage that if people are interested in learning more about it, they can go to our website at ahn.org and actually get a copy of that needs assessment information and what we're doing about it, what we're doing to address the issues with tobacco abuse, obesity, diabetes, and behavioral health issues. There are initiatives that we have that are actively occurring to address the needs as they've been identified.
And how do you think that helps with certain areas in the community as well?
Well, it helps in many ways. I mean, clearly, and honestly, sometimes it's just providing education to people, because I think people don't know sometimes what their risks are for identifying certain diseases, or I should say developing certain diseases. I think there's still a lot of opportunity to improve public awareness about what the risk factors are for certain cancers. We have a wonderful lung cancer screening program now that's readily available for people that have been using tobacco for a long time. So we just need to continue to get the word out and educate the public about what risk factors are for chronic diseases and what screening modalities are relevant for them based on their age and gender, and then remind them of where the access to all that is.
Does St. Vincent have anything in place for the lower income families if they come in here for health services? Maybe they aren't insured that well. Is there any type of services for that?
Yes, we do. For anyone that has no coverage for their services or maybe partial coverage, we work with those patients from the moment that is identified to either get them to the proper coverage, what's available for them. They might not know what coverage is available to them through the state, for example, or to work with them on payment options. So that is done on a case-by-case basis and certainly readily available.